The person has lost a person, it's been 3 months, they're still crying every day, they can't go to work, that's not quite normal. Maybe they need a remedy. So always think about, you're going to have good common sense. Okay, what can we do with homeopathy? All the modern mental disorders, as well as some major benign, some minor, more benign conditions like jealousy and guilt can be treated with homeopathy. It's amazing the scope there. Nearly 1/8 of the repertory is dedicated to mental rubrics. And we have about 530 mind rubrics in Kent's repertory. So a lot of rubrics, a lot of different minute signs and symptoms that homeopaths pay attention to on the mental level. Dr. Edward Schultz, MD, this is a quote from him. He basically says, in his opinion, you can treat just about any psychiatric problem with homeopathy other than mental retardation and severe dementia. Based on my experience, I would agree. It's difficult to turn around Alzheimer's. It's just homeopathically, although I've heard of it, but I haven't been able to do it myself. I bet doctors like Dr. Herskey and other masters might have had good success with that. Translating the language of repertory to modern psychiatric terms. This was the most difficult aspect of the preparation for the talk. I really had to look around and find some good resources for you. And here is some good resources. I highly recommend those books, especially number 2 and 3. Manual of Psychiatry by Dr. Bakshi. I believe he's Indian. It's unbelievable. It's absolutely critical. He has all the rubrics you need for various psychiatric disorders. I will just show you really quick if I can find it. So remember on the homepage of my visual homeopathy site, under this right here, the addendum to today's talk, in this one right here, addendum, if you click on that, you go to this whole section where we have all the rubrics for the various that Dr. Bakshi talks about in his talk, in his book. I'll just show you if I can find it. Right there, see? Like bipolar. He's got all the different rubrics. OCD. You see the rubrics? Delusional themes by Bakshi. Here, schizophrenia. Different rubrics. You see that? Mind. So this was invaluable. It's absolutely priceless. I looked for this for months, and I didn't know it existed. So highly recommend that. And then, of course, number 2, the modern guide to an index to the mental rubrics of Kent's repertory. Highly recommend that book, too. So you can use these books to translate the old language to modern language. Okay, this is just some sample mental rubrics that I just threw in there. Obviously, under each rubric, you got like so many remedies listed. So hopefully it's not news to you that you have to look at all this, say 20, 30 remedies under each rubric and figure out which of those remedies is the best match, right? That's like, for those of you who don't do homeopathy, that's how you go about it. I just had to throw that in. We got some funny things in the repertory, like the rubric barking or spits in people's faces, or it's just amazing some of the old things that they threw in there. So there are some old terms, again, that I had a hard time equating to modern terms, like insanity and idiocy. I believe those are the modern terminology would be psychotic disorders, as well as developmental delays for those. So you may find that interesting, useful. Okay, so let's talk about constitutional homeopathy. What is a constitutional homeopathic remedy? The person, the remedy has to match a person on all levels, physical, mental, emotional. It has to totally be a perfect match with the person's mental, emotional traits, behavioral patterns, all the physical symptoms, head to toes. So we're talking about the perfect fit. Does a person's constitutional remedy change? Well, this is a question that took me years to understand, and I thank God that we had Dr. Herskey do this, provide this illustration. With his permission, I've used this in my book. Basically, he talks about, you saw this at Dr. Amy's talk, I think 2 days ago. She put it up. So I think this is phenomenal. You got the 4 phases, and from what I understand, if you're not in phase 1, you're in trouble. I mean, even in phase 1, you could be very sick. You could be a really out of balance sulfur. But phases 2, 3, and 4, there is no healthy versions of those remedies. Like, you can't be a healthy burrito carb. I guess you can be as healthy as a burrito carb can get. But is burrito carb a healthy constitution? No. Is Helleborus a healthy constitution? No. Can you be a healthy Helleborus? From everything I understand, no. So if you're over there, you're a mess. So over time, the idea would be with homeopathy, you can transition to phase 1. You want to be in phase 1. And I've seen a lot of phase 3s and 4s go to phase 1. I haven't had the honor of seeing a lot of phase 2 goes to phase 1. And that's something, good question for Dr. Herskey. I haven't seen a metarhizium go to phase 1. I haven't, but I'm sure you can. I haven't had a carcinosin go to phase 1 myself. So, but phase 3s and 4s, I've had tons of them. Sometimes in an hour. Like a Helleborus case, I have a video of Eric, Eric's video on my website. The guy that is on the homepage of my visual homeopathy website. That guy right here, this is the homepage of the visual homeopathy. This guy right here, he was in Helleborus case, phase 4. Give him the remedy, 45 minutes later, his migraine that he had, 10 out of 10 pain for several months, it literally stopped, never came back again. He was about ready to shoot himself, he said, because the pain was so bad and so steady. And literally in 45 minutes, we had the whole thing video live while he was taking the remedy, and then he got sleepy afterwards, went and slept in the next room, came back, the headache went, and never came back again. So that's at phase 4. It seemed to me like he was basically good to go after an hour, but he said it took a few days for the headache to be completely diminished and never came back, and he became pulsatilla, which is, when I saw him, I thought, he must be pulsatilla. He seemed like a pulsatilla type person, but he didn't have any like the keynotes of pulsatilla. He had switched constitutions because of some great tragedy, concussion. He had a concussion. So going back here, does the constitutional remedy change? Yes, it does. If you're in phase 1 and your trauma occurs, you can go to phases 2, 3, and 4. Okay, we'll talk more about that. Can you tell someone's remedy by looking at them? Now, in my visual homeopathy classes and website, I claim you can. But I should specify, you can tell the person's simillimum. I believe you can tell the person's simillimum often, not always, but often, say 70% of the time, by just looking. But you can't tell a person's constitution. Now, this is also taking me years to understand. What's the difference? And I'll tell you more about that in a minute. But a couple of quotes from Masters, Nash. The skillful observer can often see the picture of the right remedy in the face and build of his patient before he speaks a word. You really, a highly skilled homeopath can do that. Not always again, but often enough that it's amazing how you can get familiar with these remedies to that extent. Hahnemann speaks of that. So, okay, so here, like for example, this person, this is like a visual homeopathy thing that in my visual homeopathy courses, I teach this sort of thing. Like you look at a person like that, and my daughter even can look at a person like that and say sepia. Like just, as soon as you look at a person like that, she looks like sepia. That would be, I believe, her simillimum. Now, but what's her constitution? We don't know, but you got to talk to them, to talk to her and see what does she have? What are all her signs and symptoms? She doesn't have any signs and symptoms. That would be a perfect sepia case, just by looking. So more about that in a minute. So now voice is a subject that I'm really into also. By listening to a person's voice, you can tell a lot about them. So this is a it's a French thing. Some French guy is talking. See if you can get the remedy. For those of you who are good in homeopathy, this is a little game. Here, ready?
Benedicat vos omnipotens Deus, Pater et Filius et Spiritus Sanctus. Amen. Bonne nuit.
Okay, what can you say about this person? Like, what's he like? He's what? He's a bold? Pope? Oh, sorry. Now, what kind of personality traits do you think he might have? He sounded strong, I think. Didn't he sound strong? Didn't he sound a little arrogant to you? Right? He did. And he's French. So I think a lot of French are sulfur. English are Nadmir. Just generalizing. So that kind of voice, as soon as you hear it, strong, he sounds really arrogant, you got to think maybe sulfur. Maybe. We can't be totally sure, but maybe sulfur. As his simillimum. But what about his constitution? We don't know. If he was traumatized in a car accident, he might need Helleborus or arnica. But his deep, cold remedy, the way he ticks, the way he was built, is sulfur. So we do a lot of that in my classes. So moving on. Okay, visual homeopathy is just a term that I use. It's a video-based approach to learning homeopathy. You're like basically guessing these people's remedies, top 20 remedies. That's all we cover. It's not a mastery kind of a course. To learn to master all the remedies, you got to go way beyond this. But this is the basic 20 remedies that you see in your practices day in and day out in a primary care setting. I would say 70% of my patients are in these top 20. That's just my patient population, which I'm more of a general practitioner. And if you see only autism, you're going to probably need to know 400 remedies. But I would say general practice, top 20. And you can get good at it like that, like sulfur, phosphorus, just like that. And my daughter here has mastered those top 20. So if she can do it, hopefully you guys can do it too. Although she's, I think, gifted at it. Just I think it's appropriate to just give you a quick, I'm not here to promote myself, I'm really here to promote homeopathy, so don't get me wrong, but this is my visual homeopathy site. There are lots of things on here, like hopefully help things that can help you. Like videos of patients you can watch. Right at the top it says this woman's remedy is pulsatilla. You can watch the video and see for yourself how a pulsatilla person carries themselves. This person's causticum. It's kind of a rare remedy, causticum. So if you need to brush up on causticum, see what they're like, watch the causticum videos. I think it's invaluable to see a causticum on video. Calcarbs, easy. You can hopefully have that down pat. Sepia, easy. Lachesis, some lachesis remedies, patients are hard to identify. This is a very difficult type of lachesis, the more mild-mannered kind instead of the more vicious kind. This is very mild. There is a mild version of lachesis, which is very hard to get. And then there's pictures. Like this woman, just the way she's posing, I've made comments under each picture, like, could she be Nadmir? Over my dead body, could she be Nadmir? Nadmir wouldn't do this. They're not wild like this. She's confident, wild, out there. I believe she's sepia, and you can read underneath why I think she's sepia. Now this one is, I intend to put a lot of pictures on my website. This one is awesome because the way she's got her hand like this on her side, and then, like this, that's such a particular, I would say a sepia attitude. You hear about how sepias have an attitude. That's the attitude caught on a billboard. Watch me get into a car wreck one of these days because I stop and take pictures on the road. So this is sepia, just looking. This is the back of a truck. I think it's a good drawing that I believe the person is most likely sepia. Again, that's similar. We don't know what the constitution at the time may be. A lot of African Americans, in my experience, 70, 80% of them are either lycopodium or sepia. This is what I've seen. Sepia, lycopodium. It's amazing. If they're not, they're either calcarb or phosphorus. That's like 90% cover. It's amazing how they have such a limited number of constitutions, African Americans. I believe it's because of suppression, personally. Not to get too political, but I believe suppression has limited their number of constitutions. With whites, I see way more variety. But unfortunately, you see far fewer among African Americans. So this is a perfect lycopodium facial appearance. Those two guys right there. This, I believe, is lycopodium. And I'll talk about this in a minute. Okay, so that's pretty much, there was one more thing I wanted to say. Just to wrap up talking about my website, a lot of those videos are all complimentary to you, but there is a members-only site. If you wanted to learn more about these videos, there are all these modules. You can sign up and become a member and watch videos as much as you want, like all these videos right there. You can click on a video like meta-rhinum and watch a meta-rhinum case. That's the members-only site where there's like 100 videos there. Okay, so going back to the actual talk. So case taking. I believe our case taking is similar to psychoanalysis. We really get deep into a person. And counseling at the same, psychoanalysis and counseling, very similar. Small details matter a lot in homeopathy. Everything we hear from the patient matters. Everything they do matters, the way they sit, the way they talk, everything. Like I had a patient come in one time, she sat right next to me, and then I have a little table next to me in the office where the blood pressure cuff goes, and she put her legs up like that. She said, do you mind? And I'm like, sure, no. And then she was like, she did this right in front of me. And she had a skirt on. So she went like that. And then she said, do you mind if I smoke? I'm like, well, I would rather not have you smoke. But she did that. Now, what constitution would do that? Rude. She's very rude. I thought she was very rude. She doesn't even know me, first thing. She had a skirt on, so I could see her underwear. So very, very hypersexual, very, very rude. She was so Palatina. Just as soon as she did that, I thought, maybe Palatina. So I asked her the Palatina question. She definitely had it. So those are not small details, but you got to pay attention to everything. You want to get into the mind of the person as deep as you can. So if you're gullible, maybe you can't be a deep practitioner. You can't get these remedies right on. You got to be kind of clever sometimes. You're like, what does the person mean by that? Like really pay attention. Okay, characteristic symptoms versus general symptoms. According to this author, madness is a personal experience. It's unique to each individual. It must be treated uniquely also. You can't just say, here's the 10 remedies for depression, because you could have lots of people that are depressed and each person gets a different remedy. So you got to really figure out how is the person depressed? What's unique about their depression? Let's say if I'm depressed, I may want to be with people just so they can cheer me up. But in Nadmir, if you're a constitutional Nadmir and you're depressed, you probably don't want to be around anybody. You probably want to go surfing all by yourself in the ocean. It's just, so you want to ask, how are you depressed? How are you depressed in general? find out as much about the characteristic symptoms as possible, instead of the general blanket term depression. Okay, some general guidelines. 90% of communication is nonverbal. I couldn't agree more. I usually can tell so much about the person just in the lobby before they even go to the back. You know, Dr. Hersky talks about that. All the masters talk about that. You shake their hand.